Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Just a quick heads up. This deep dive was created using generative AI tools to support accessibility and clarity. The content is grounded in the research and instructional work of Dr. Michael Jones. Welcome to the deep dive. Today, we're really plunging into something foundational, absolutely core to good therapy, no matter how it's delivered. We're talking about the therapeutic relationship. For so long, we've built these connections face-to-face in the same room, but now, with telemental health taking off, there's a big question. How do you actually build that deep, meaningful connection, that real trust when you're separated by screens? It's a fascinating challenge. We've gathered some really interesting research and practical insights today. And it's not just about the hurdles, but also some surprising upsides and key strategies for making these virtual alliances strong.
It really is remarkable, isn't it? Because while the way we deliver therapy has changed dramatically, the basic ingredients of what makes it work, those remain pretty much rock solid. And here's something that might surprise you. Research, like recent work from Novella and N, and also Watts and colleagues from a few years back, it's showing that these virtual alliances, they can be formed. And often they're just as strong, sometimes maybe even stronger than in-person ones.
Wow, stronger even. That definitely pushes back on some older ideas about needing to be physically present.
It does. It shows how adaptable therapy and human connection can actually be.
Okay, so let's really unpack this term. Therapeutic alliance. What are we actually talking about here?
At its heart, it's that collaborative partnership. It's the working relationship between the therapist and the client.
Built on
mutual trust, definitely. Also, being on the same page about the goals, what you're aiming for, and crucially, that emotional bond, that feeling of connection and understanding.
Right, the engine driving the whole process. Yeah. And it's widely recognized, isn't it? Ethically essential.
Absolutely. Major guidelines, like the ACA's Code of Ethics, they clearly state it's a critical predictor of good outcomes. That holds true across all kinds of therapy, regardless of the specific techniques used.
And this cornerstone, as you called it, has really been tested lately.
Oh, massively. The huge shift towards telemental health, especially, pushed by the pandemic, it's fundamentally changed how providers have to think about building and maintaining these relationships.
So it's not just about learning the tech.
Not at all. Yes, you need technological competence, obviously. You need to know how the platform works. But just as important, maybe even more so, are those relational skills adapted for the digital world. You have to be intentional about bridging that gap.
So if this alliance is so critical, how do we get a handle on it, especially online? Is there a way to measure its parts?
Yeah, there is. A really useful tool is the Working Alliance Inventory, the WAI. It's designed to measure those key dimensions we talked about.
The bond, goals,
and tasks. So the emotional bond, the agreement on goals, and the agreement on the tasks or methods you'll use to reach those goals. And what's really helpful is that there are versions adapted specifically for virtual settings.
Like for VR therapy.
Exactly. There's a YVR for virtual reality, and also a YTech-SF for more general online interventions. So we can track this stuff.
That's really interesting. So, okay, let's talk about that first part.
Yeah.
The emotional bond. How do you actually create that feeling, that real connection through a screen? It just feels like it would be harder.
It does feel that way, and that's a common worry for therapists starting out with telehealth. But here's a fascinating finding, going back to that Watts study. Sometimes clients actually feel more comfortable opening up from their own home.
Really? More comfortable?
Yeah, that familiar environment can sometimes lower defenses, strangely enough. But because you don't have that physical presence, the therapist has to be more deliberate, more intentional.
About showing empathy.
Exactly. Demonstrating empathy, showing you're attuned, conveying genuine care through your words, your tone, your facial expressions, whatever the client can see. And interestingly, Lopez and his team found that therapists often express more worry about building the alliance online than clients actually report feeling.
So therapists are maybe more anxious about it than they need to be.
Potentially, yes. Which really points to the need for good training, helping providers build confidence in their ability to connect digitally.
Okay, so the bond is possible, even strong. What are the other parts? goals and tasks. You might think collaborating on those things would be clunky online.
You might think so, but actually the collaborative side of setting goals and agreeing on tasks, that can sometimes be boosted by technology if used well.
How so?
Think about screen sharing. You could look at a thought record together right there on the screen.
Or fill out a worksheet collaboratively in real time.
Precisely. Using shared documents, interactive platforms, these tools can make the working together part more concrete and engaging.
So the key is making the tech work for the therapy, not against it.
That's the principle. Technology has to serve the therapeutic process. It shouldn't feel like a barrier or just another thing to manage. It should facilitate that collaboration.
But let's be real. Technology doesn't always cooperate.
Oh, yeah. We've all been there.
That frozen screen, the audio cutting out right when someone's saying something important, that's got to be a major threat to the alliance, right? As Lopez pointed out, those tech glitches, bad connections, platform bugs.
Absolutely. They are a significant risk, and that's why preparation is so critical.
What does that look like? Backup plans?
Definitely backup plans. Also, doing a tech orientation with the client beforehand, making sure they're comfortable, troubleshooting potential issues early, and crucially, framing those inevitable glitches not as disasters, but as opportunities.
Opportunities, how?
Opportunities to problem solve together. It can actually model resilience and strengthen the collaborative aspect, weirdly enough. Like, okay, this isn't working, what's our plan B? It becomes part of the work.
That's a great reframe. And beyond just fixing tech issues, there's this idea of digital presence. What's that about?
It's about more than just being logged in. It's conveying that sense of really being there with the client in that virtual space and ensuring the client feels that genuine human connection despite the screen.
How do you cultivate that? Just good lighting?
Good lighting helps, but it's more. Springer and colleagues talked about optimizing camera angles, minimizing distractions in your background, and really making intentional eye contact looking at the camera lens, not just the screen image, to simulate that direct gaze.
Okay, that makes sense.
And here's a key thing. You might actually need to consciously amplify your nonverbals a bit.
Like bigger facial expressions.
Yeah, slightly exaggerated facial expressions, maybe more noticeable gestures. Just to compensate for the limited view the client has, it's about making sure your warmth and engagement really come across.
Got it. Okay, shifting gears slightly but still related. Let's talk ethics and culture in this virtual space. Cultural competency seems really important here.
Hugely important. As Gupta and others noted, things like comfort level with technology, expectations around privacy at home, even communication norms, these can vary a lot across different cultural backgrounds.
And virtual therapy adds another layer to that.
It does, but interestingly, it can also offer unique ways to be more culturally responsive.
How so?
Because sometimes you get a glimpse into the client's actual environment. You might see things or understand contexts you wouldn't in an office. But that increased access, it demands extra care around boundaries and real cultural humility. You have to be so mindful.
And language barriers.
They can potentially feel more pronounced when you lose some of those subtle nonverbal cues that help understanding. So you need really sensitive, clear, culturally appropriate ways to communicate.
Which leads right into the ethical side. There are clear obligations here, right?
Absolutely. The ACA Code of Ethics, for example, is very clear. Standard C22.A says providers need competence in new modalities before using them. And that definitely includes telehealth needing both the tech skills and the specific relationship skills for working virtually.
So it's not just an optional add-on.
Not at all. And accrediting bodies are reinforcing this too. The KCREP 2024 standards, specifically to .f.1 highlight understanding how technology impacts the therapeutic relationship.
KCREP, right?
KCREP, exactly. And codes like the NBCC's emphasize privacy and confidentiality online, which is just paramount.
So ongoing training is key.
Vital. Ongoing training, supervision, maybe even reviewing recordings of virtual sessions, if possible and ethical, to get feedback on how you're connecting, consulting on those specific telemental health challenges.
Okay, let's get really practical. What are some concrete techniques or communication strategies that really help build that connection online?
Well, adaptive communication is key. You often need to rely more on verbal processing.
Meaning you talk things through more explicitly.
Yes, explicitly naming observations or even your own emotional responses that might just be conveyed non-verbally in person. And Scheidt talked about this, like saying, I'm noticing or I'm sensing a bit more often.
Makes sense.
Yeah.
What else?
Thinking about the overall approach, Ayana Kiva identified a style that works well. Being friendly and positive, but also firm when needed. combining that with an inclusive, empathic attitude, and really making an effort to humanize the technology, not letting it feel cold or distant.
Humanizing the technology. I like
Yeah.
that. Can using different channels help? Like messaging plus video?
It can, yes. As Manfreda pointed out, integrating things like secure messaging can enhance engagement between sessions, but you need really clear boundaries around that. How often, response times, what it's used for. Otherwise, it gets messy.
Right. Boundaries are always key. What about clients with more complex issues or high-risk situations? Does the virtual format pose unique challenges there?
It certainly can. As Hoffman, Lampomer, and others noted, those reduced nonverbal cues can sometimes make it harder for a therapist to pick up on subtle shifts, or even to read their own internal reactions, their countertransference, which is important data.
So safety planning becomes even more critical.
Absolutely paramount. You need crystal clear, frequently reviewed safety plans and crisis protocols, knowing exactly what to do if there's an emergency when you're not physically there, and thinking about diverse or marginalized groups. Telehealth increases access, which is great. But we have to be super aware of the digital divide. Does everyone have reliable tech and internet? And privacy concerns. What if someone lives in a crowded household? Is it truly a private space? How does the virtual setting impact their feeling of safety? Lots to consider.
And the physical environment itself, both yours and the client's, how much does that play into it?
It plays a significant role. Providers should actually guide clients a bit in setting up their space.
Like suggesting good lighting or minimizing distraction.
Exactly. Thinking about lighting, seating, ensuring privacy, reducing interruptions as much as possible, while obviously respecting the reality of their home situation. Bringing therapy into their life context can be powerful. It helps generalize skills. But again, boundaries are needed so home life doesn't constantly intrude on the therapy time.
Okay, looking ahead now, things are evolving so fast. What about AI in therapy or these digital therapeutics? How does the alliance fit in there?
That's the cutting edge, isn't it? Wiederhold wrote about this. We're entering territory where the alliance might not just be human to human. It could involve a relationship between a human and an AI tool or a digital program. What does that look like? We're just starting to figure that out.
Wow. And what about mixing modalities, like some sessions in person, some online?
That seems very likely to be the future for many. Flexible, hybrid, blended models. And there's actually research suggesting these blended approaches, like blended CBT or BCBT. Ducani's team found they might even improve working alliance scores compared to just doing one or the other.
Interesting. So providers need to get good at managing relationships across different platforms.
Exactly. It demands flexibility and competence in navigating those transitions smoothly.
Okay, so wrapping this up, this has been a fascinating dive. It sounds like the therapeutic relationship in telemental health is, well, it's both the same and different.
That's a good way to put it.
The core principles, empathy, collaboration, trust, they're timeless. They don't change. But how we express them, how we cultivate them online, that requires real thought, real adaptation. Intentionality seems to be the key word.
Absolutely. Success here really hinges on that dual competency. Knowing the tech, yes, but more importantly, being highly intentional about the relational process. Therapists who can do that, who embrace the possibilities while staying grounded in those core relationship skills, they can build alliances online that are not just good enough, but genuinely powerful and sometimes uniquely suited to certain clients or situations. It just requires that ongoing commitment to learning, to cultural humility, and to solid ethical practice as the technology keeps evolving. So as you reflect on all of this, here are a couple of questions to consider. First, how might this idea of adapting the therapeutic alliance for virtual settings show up in your current work or role? Even if you don't do telehealth now, how might these concepts apply? And second, what, if anything, might you want to approach differently moving forward based on what we've discussed today?
Great questions to ponder. Thank you so much for joining us on this deep dive. We hope it's given you some valuable food for thought and encourages your continued learning.